Lagos Traffic Radio 96.1 FM. Safe Blood Arena is brought to you courtesy Lagos State Blood Transfusion Services. And on this program, we talk about everything that has to do with blood donation, voluntary blood donation, and how your blood, donated blood, how they are used for the betterment of mankind, or as we say, for saving lives. Today on the program, we shall be focusing on World Hepatitis Day and implication for availability of safe blood. Well, for those of you who don't know or didn't know, yesterday, July 28th, was World Hepatitis Day. So today we'll be focusing on that day and the implication for availability of safe blood. And I have with me in the studio our guest, Dr. Ademola Adewoyin, a consultant hematologist from the Infectious Disease Hospital, Yaba. Welcome to Traffic Radio.
Thank you very much. It's a pleasure to be here.
All right. Looks like you're soft-spoken like me. And of course, we have Mr. Oluwole Olatubi, the program head, LSBTS. Welcome to Traffic Radio again.
Yeah, welcome. Thank you.
All right.
For tuning in Lagotians.
Okay.
It's your program.
Yes, indeed. Yes, indeed. All right. So, the theme, let's begin by talking about the theme for this year's World Hepatitis Day and what are the types, symptoms, prevention, and treatment. So first we'll start with the theme for today, then we'll take it off from there.
Yeah, thanks. Like I said, it's a pleasure to be here. So the theme for the 2024 World Hepatitis Day, it's a call to action. Let us test, let us treat, and let's vaccinate.
Okay.
That's quite an interesting one.
Very, very interesting.
Yeah, for me, it's quite, encapsulates the essence of public health measures that tie around hepatitis.
All right.
In the sense of looking at it at different prongs. So you're looking at how to prevent, you're looking at capturing people who have hepatitis and then ensuring that they don't progress to have complications. So it's a whole fully packed team for the year 2024.
Okay, so let's talk about the types of, well, I don't know how many, but I know of A and B.
Right.
So let's list the types, let's list the symptoms, the prevention, and then the treatment for them.
Right. So hepatitis, as the name suggests, they are kind of infections caused by viruses that love to attack the liver. That's actually how the name came about. So HEPA is actually the liver.
Okay.
Liver is one of the major organs, vital organs in the body.
Yes.
So hepatitis are caused by viruses that go for the liver. So we could call them viral hepatitis. So there are other types of hepatitis. It could be induced by heavy alcohol use, for instance, will cause some kind of hepatitis we call chemical or toxic hepatitis.
Okay.
So if somebody takes agbo concentrated one, their liver could fail. So that's a kind of hepatitis. So that's a kind of inflammation of the liver. We call that hepatitis. But when it's specifically caused by viruses, we call that viral hepatitis.
Okay.
So there are different kinds of viral hepatitis. So you hear hepatitis B, hepatitis C, hepatitis A, hepatitis E, hepatitis D. They kind of follow the alphabet, so it's kind of
all the way to D.
There's even hepatitis E as well.
Oh my!
Right? Yeah. So those are the types of viral hepatitis, the common ones we usually talk about. But I think topping the list will be hepatitis B and C. These are more frequent ones. These are the ones that are transmitted by blood and blood products. So if you ask me for the symptoms, it also depends on the kind of virus we're dealing with. So hepatitis A, for instance, or hepatitis E, typically we say they are transmitted through food and drinks. So they are fecal oral. They are transmitted by what we put in our mouth. So those kind of viruses, they would cause enteritis. They will cause, gastroenteritis, like stooling, like vomiting and stuff like that. Of course, when it's an acute infection, there will be fever. So acute infections are followed by inflammation, which manifests as fever. But something like hepatitis B or hepatitis C, those are transmitted by blood. So contact with blood that is infected with the virus will lead to transmission. So those kind of contact could be by sharing of sharps or needle stick injury in a healthcare setting.
All right.
It can be transmitted by sexual exposure. So unsafe sexual practices could transmit hepatitis B and hepatitis C.
Okay.
So really the symptoms or symptomatology of these viruses really depend on how, what kind of virus we're dealing with.
Okay. So what about prevention?
Right. So prevention, it's all about breaking the chain of transmission.
All
so
right.
if we're trying to prevent the ones that are transmitted sexually or transmitted by blood, we need to look at the sources of the infection, and then we need to cut the sources. So if we need to prevent hepatitis B and hepatitis C, so we're talking about, ensure it's a safe sexual practice, abstinence, the use of barriers. If we're talking about exposure through needle stick injuries, of course, we're talking about protocols to ensure sharp safety.
All right.
So in the hospitals, there are sharp boxes that needs to be used. There are practices like don't cap needles, because if you cap needles, it increases the risk of getting stuck or getting a needle stick injury. We talk about how we handle blood and blood products in the hospital. So if there's a spill of blood in the hospital, or there's some sort of blood spill anywhere, how do you handle that? So containment management, how you contain or manage your spill in a healthcare facility. So these are kind of things we talk about and we look through in order to break the cycle of transmission of hepatitis.
Okay, so you said one of them can be transmitted through food.
Correct.
So how then do you look out for that? What do you look out for to make sure that that doesn't happen to you? Because you know that right now, there are so many people who are always on the go. They get food on the go or eat out. So how do you ensure that you don't get infected?
Yeah, I think it's all about hygiene. It's typically the way to break the cycle. So hygiene is very important. I think topping the list is hand washing. It's been proven to be the most important measure.
Okay.
So, yeah, of course. There are other policies or processes that we do like to establish, like having people that handle food, especially in public settings or dispensaries, ensuring that they have they've been adequately tested and that they are free or they are not in a position or in a phase of infection where they can transmit to other people. So that's commonly done through the food and last test, which is very important. And that cuts across other foodborne pathogens as well. So those are the ways we look at it, by looking at how this box gets transmitted and looking at what we need to do to prevent from transmitting from the source or the contact or the person who's got infection to another person who is infection free.
Okay, so we've talked about the different types of hepatitis. We've talked about the modes of transmission, prevention and treatment. So what is the implication right now for availability of safe blood and blood safety?
Yeah, so safety is a very big topic in healthcare, especially healthcare delivery, because, the mantra of care, one of it says non-maleficence. So we need to ensure that when we're treating people, we don't add additional burden. We treat them, give them the best possible treatment with minimal, little or negligible or no complications at all. So it is contrary to practice to give contaminated blood. And so if you have a population with a high burden of hepatitis, it means that you have reduced amount of available blood units because the people to donate are infected with virus, and so they are not in a position to donate. And so it's a very major concern, and it's why we're pushing for an hepatitis-free world. So we need to just ensure that if we can reduce the numbers of people who have this pathogen, this virus, then it will certainly increase availability of prospective donors who are fit to donate, and then that would increase the pool of blood units that are available for use, and then of course that would improve healthcare outcomes.
So let's take a look now at how we can reduce the risk of contracting hepatitis from blood transfusion. I know on this program we have talked about the different process of screening that blood goes through before it is eventually transfused. Let's quickly take a look at how we can further reduce risk. to exposure of contracting hepatitis?
Yeah, so thanks for that question. We do reduce the risk by looking at what the risk is. So we certainly need to be able to tell the magnitude of the risk we are dealing with.
Okay.
And then we need to tell ourselves where are we? Are we having a high burden? Are we having a low burden? And then what do we need to do in order to further make the risk less and less so that we can achieve some freedom with regards to the virus.
Okay.
Now, in specifics, some of the thoughts that will come to mind is the need to prevent.
Okay.
So if we can prevent it, then certainly that will reduce the number of persons affected.
Yeah.
The second thing is to get to be able to detect early. So if you can detect that, these persons have this virus, and then you're able to route them to optimal treatment, then you can certainly reduce complications. Some of them might be lucky and then they go back to a disease-free state, and then they also are able to join the pool of prospective donors who can add to your blood stock for healthcare needs. So that's, some of the things we can do. But of course, in specifics of testings that go into the process of releasing blood for people that need blood, there are mandatory requirements, and one of them is to have the hepatitis screens done, hepatitis B and hepatitis C, judging by the current policy that we operate in Nigeria. So these testings need to be done, and they need to be done accurately. And so if a test is positive, it's actually positive, and that's the accuracy, that's the level of accuracy that we need to run by. And of course, there are further actions that follow that. Persons that test positive, persons that test negative need to be encouraged to maintain healthy practices. Persons that test positive needs to be routed for proper treatment and optimization.
So it means that a person who has hepatitis A to E or A, B, C, D, E, can the person donate blood?
No. So again, for blood donation, we're a bit more focused on hepatitis B and C. And if someone comes to donate, which is goodwill, altruism, and the person is detected to have hepatitis positivity, we certainly would defer. It's one of those deferrals, So when someone comes and they can't donate, we call that a deferral. It can be permanent or temporary. So that kind of person is deferred from donation, and then there are subsequent things that we do, in order to, we need to know what state is the virus. We need to know if the person is qualified to get treated, and then we need to follow through on the outcomes. And then some people are lucky with very strong immunity; they could become hepatitis free and free of the virus. Then they can donate in the future. But for people who become chronic carriers of the virus, certainly they need to be followed up in order to prevent complications like liver cirrhosis or the liver cancer.
So what makes a person eligible for treatment? In case the person wants to donate blood and then it's found that the person has the hepatitis virus, what makes the person eligible for treatment?
Yeah, so for every treatment there are what we call criteria for case definition and criteria for intervention. So for instance, if someone has just got a carrier status and that's running a chronic infection, so the bug is there but it's not active. We usually don't go fighting a virus that is not causing any problem. So it's chronic inactive state. Or if it's chronic and it's active and we see evidence, usually we run panels of tests to look at that. So they are the viral load checks that we do. If it's chronic and it's active and we're seeing evidence of liver disease, certainly this person needs to be treated. And of course, that is by introduction of antiviral agents and monitoring the patients closely.
Okay. So, as regards the World Hepatitis Day theme, which is it's time for action, a call to action, tell us what the key messages are regarding voluntary blood donation, because we just established that someone who has the hepatitis virus and is at a chronic state, the person is not eligible to donate blood, and maybe not eligible either for that treatment. They can only manage it. Yes? So what are the key messages for the World Hepatitis Day, the call to action? What are those key messages as regards voluntary blood donation?
Yeah, so the key message is it's threefold. So let us test. Very important. So testing is very, very important because you can only pick or detect if there is a bug, if you do test. So let us test. The other one is let us treat. So treatment is very important. So somebody is gotten a test and the test says it's positive. Certainly we need to treat. Treatment does not necessarily mean initiating the medications immediately. Treatment means seeing the healthcare professionals and having a more thorough assessment. Treatment could mean getting counseling and more education around what to do and how to prevent or how to interact with people to reduce the spread of the virus. So very important. So treatment is in different phases. So let us test, let us treat, and let us vaccinate. So vaccination, it's more primary preventive measure. So you're even preventing people from getting the virus as a primary measure. So, and if you do a prevention level practice, you're not going to have any disease burden because you're preventing it primarily, and that's what vaccination aims to achieve. There may be a difference between vaccination and immunization. So sometimes when we vaccinate people, which means we give them the virus, we need to check their immune levels. So for instance, most healthcare settings would have a policy around knowing the immune status of their personnel for hepatitis. So they might do the antibody level checks. So you've been vaccinated. How about if the vaccines failed? So you vaccinate, and then we also check what is the immune status, and do we need to give booster doses. So let us test, let us treat, and then let us vaccinate. And the goal of vaccination is to ensure that people build immunity against the bug, against the virus.
Okay. So, all right. I have one more question for you. It's out of the, but it's still a question. Now, for those who are, because we said, I think the B and C can be sexually transmitted.
Correct.
Okay. Now, for people or young people who are sexually active and they're probably not aware, they're probably aware of the usual infections, but not that of this particular type of hepatitis. And what is the advice to them? Because they also make the bulk of the people that can donate blood. So what happens in a situation where they're not aware that they need to prepare themselves, or they need to shield themselves from this kind of infection so they can become eligible for voluntary blood donation?
Right. So that's a very great question. So that's where education comes in. People need to be aware. We need to keep raising public awareness to sensitize people about this virus. One thing I should say is that this virus, hepatitis, is more infectious than even HIV.
Wow.
The dreaded HIV, it's 5 times more infectious. So the chance of contracting hepatitis is even stronger than HIV.
Wow.
And it's sexually transmitted and missed other sexually transmitted infection. And the way to do that is also to help people understand what is meant by safe sex. So for persons who abstain, that is a great measure to reduce the chance of contracting the virus. For persons who are sexually active, of course, the chances of contracting viruses is more with multiple sexual partners. So being faithful to one partner is a lot more protective. And then, of course, the importance of using barriers, contraceptives like condoms, is very, very important in order to limit the risk of contracting the virus. So I think this is important, and this needs to be out there, for public good and public awareness.
Cool. Thank you. All right, so I've been speaking with Dr. Ademola Adewoyin, a consultant hematologist with the Infectious Disease Hospital, Yaba, and we've been discussing World Hepatitis Day and implication for availability of safe blood. And yes, program's head.
Yeah.
So how does LSBTS and blood banks ensure safety of blood supply in relation to transfusion, transmissible infections like hepatitis?
Okay, thank you for that question, Dele. So Lagos, LSBTS, that's Lagos State Blood Transfusion
Services, yes,
was enacted by law to ensure the safety of blood in the state and its availability. So the first thing for us, how do we ensure the safety, is to ensure that there's compliance with the law. setting up the Lagos State Blood Transfusion Services.
Okay.
And also the blood banks have to comply, everyone that has to do with in the whole blood ecosystem.
Okay.
From donation to screening to storage to transfusion, everybody has to comply to the law setting up the Lagos State Blood Transfusion Services.
Okay.
That is why we have the monitoring committee that goes around the different players to ensure, even in the hospitals where the blood is transfused, even up to the people that transport the blood products, to make sure that the blood
is handled safely.
The whole idea is to make sure that, to maintain some form of cold chain temperature while they move the blood from one place to the other. To also the screening centers. So first of all, we ensure, so at the point of the donation, remember we talked about voluntary, why we are hammering on voluntary blood donation is because we found out that this group of people are the people that have the least level of infections, like this hepatitis, Dr. Adewoyin mentioned, HIV. They have the least because they donate blood for altruistic reasons. They are sincere in answering their questions and things like that. So we found out that we have a reduced number of people. So that is why we encourage voluntary blood donation. They're not in there for pecuniary gains. So the second level we want to look at is the screening level. So that's the point where we adhere to everything we do. Remember, we adhere to World Health guidelines and standards. So at the screening level, there's a screening method. It's the ELISA 4th generation method that is used to screen, described by the World Health Organization. And the beautiful thing is that Lagos State in the entire federation, by executive order, is the only state that uses a fully automated screening apparatus. The whole idea is to reduce human error. Human contact, human error.
Yes.
And if you look further, we make sure that because we have screening partners, because we are relying on the efficiency of the private sector to come and ensure that, because we don't, that's a place that the margin of error is zero for us. We don't want any of these infectious diseases you mentioned being transfused. So that's why we have that's like the minimum requirements, minimum standard to be a screening partner in Lagos State. And we're here to say, we are proud to say that our screening partners, for example, like one of them, there are people that have grown, their professionals grown a lot of capacity in their field, in their area. There's a company in Galex, they're at lawsuits, there are people that have over the time have shown, because they know how serious we take these things, and they all adhere to all our standards. Then you also have I talked about the cold chain thing, where we maintain a certain level of cold chain. So back to what he said. So the whole idea about, a call to action, to test, to treat, and then to vaccinate. So you walking into our facility is like a call to action. Just walk in. You have the advantage of, because at the end of the day, if we should find out that you have any of these transfusion transmissible infections like hepatitis, what we do is that we're going to let you know, we're going to call you, we're going to cancel you. Remember, you talked about the next, if you look at the trend is action, time for action, you test. So by the time we screen or you find out you have this, the next thing is that we'll now refer you to a healthcare professional that Dr. Adewoyin mentioned, so the whole idea is, and for the young ones, is earlier, because you can see the modes of transmission that you mentioned. So it's very important that you avail of yourself of this opportunity, even though your health status. We're always talking about all these free checks that you stand to gain as a voluntary blood donor. So I think we're good.
I also think a lot of times you find that people may not. Well, I think one of the reasons people may not want to come forward is the fact that in this part of the world, want to do everything, do it and keep it to your chest. You don't want the next person to know. So even when you have an infection, coming forward to donate blood means that it will be detected during screening. And then so they're like, okay, so will this the person's identity, there's confidentiality, I'm sure, during the screening, and even when anything is detected during the screening process, the person is counseled, treated, and all of that without any other person getting to know what's going on. Yes?
Correct, yeah.
True. So I think we would also need to emphasize that fact that even when you come forward to donate blood and anything is detected during screening, the other person is not going to know anything. No other person is going to know anything. To be treated with the highest level of confidentiality
and
privacy,
Yeah.
so that whatever is happening is between you and your doctor, or between you and the healthcare provider that is taking care of you at that time.
Yeah.
Yeah?
Correct.
All right.
It's also important I quickly check in this because Dr. Adewoyin mentioned about the high level of infection, how contagious the hepatitis B and C viruses. So going from our statistics at the Lagos State Blood Transfusion Services, it's about, so compared to HIV, hepatitis has 3 times the number of HIV patients.
Wow.
People that are tested positive for HIV is 3 times. So
And not much noise is made about it as with HIV.
So this has, as I said earlier on, it has implications for public health.
Okay.
Exactly.
Okay.
So we want to, I don't know whether Dr. Adewoyin want to maybe make a final appeal for to
15 seconds for your appeal because of time. 15 seconds. You have any other passionate appeal?
I mean, I would just say, really, it's time for action. Let
Okay.
us test,
Okay.
let us treat, and then let's vaccinate.
That's nice. All right, great. All right, so that's our package on Safe Blood Arena today. We've been speaking with Dr. Ademola Adewoyin, a consultant hematologist from the Infectious Disease Hospital in Yaba, and also Mr. Oluwole Olatubi, the program head, LSBTS. For more information, you can get to the LSBTS Facebook page. It's Lagos Blood Transfusion. On Instagram, it's Lagos State Blood Transfusion. On X, is Lagos BTS. And the telephone number you can reach them on is 0806 920 7914. Again, 0806 920 7914. Thank you so much, everybody, for listening. Thank you again to my guests. My name is Dele Agadumo. Big thanks goes to Victor Terry and executive producer Tayo Akonle. Safe Blood Arena comes your way Mondays on Lagos Traffic Radio 96.1 FM at 4:30.